Hello, everyone, and thank you for joining us today. It is the November 3rd, 2021 All In for Kansas Kids bi-weekly webinar. And I am Debbie Deere, joined by my partner, Hannah McGahee. We plan the webinars together, and we both work for the Kansas Children's Cabinet, and we're happy to have you here with us today. So for today's agenda, we will, as always, share the general updates on opportunities that are available to you throughout the Early Childhood Network in Kansas. And today, if you will please note that each of these informational slides that we share with you will now also include in the caption how the information ties back to the All In for Kansas Kids strategic plan, goals, and strategies, which we're always trying to keep our eye on. We will also have a presentation by the Kansas Racial Equity Collaborative, who will share details about an upcoming opportunity for a learning lecture series that they have. And then Michelle Allen from DCF will be sharing a more in-depth look today at the pandemic relief funding efforts in Kansas through the Child Care Development Fund and Coronavirus Relief and Recovery Appropriations Act monies. So our first general announcement, the Early Childhood Workforce Advisory Group is conducting their 2021 annual Workforce Needs Assessment Survey. So due to COVID, this annual survey was not done last year in 2020. So your responses to this year's survey are greatly needed and will be used to determine the training needs and interests of childcare providers in Kansas. The survey is available to anyone who works in an early childhood setting and provides care to children 0 to 12 years old. So you were invited and encouraged to complete the survey through November 21st, and you can contact Ccdf at this email address if you have any questions. We continue to remind you of the free training on the ASQ Ages and Stages questionnaire, which is available on a couple more dates in November and December, which are listed here. The ASQ3 training is designed for any professional who has contact with children younger than 66 months of age. And this will help you identify developmental delays. And the ASQ SE2 training is designed for any professional who has contact with children younger than 72 months of age and will help you identify social or emotional difficulties early. And the early identification of these delays will allow children and families to receive services as soon as the delay is recognized. And so you can find more event and registration details on the TASN website, which is listed in the chat. And participants in this training can also earn KDHE clock hours. Music and Me is an online event taking place on November 12th for parents with children ages birth to 3 who have developmental delays or disabilities. This event is sponsored by the Kansas School for the Blind, the Kansas Deafblind Project, and Ideas That Work, which is through the Special Ed Department of the U.S. Department of Education. Ms. Hillary will be the host, and she is a music therapist, a special education teacher, and a teacher of students with visual impairments. So to register, you can go to the link provided in the chat, or you can also contact Maritas Altuna with the Kansas Deafblind Project at the email provided here. Kansas Power of the Positive invites workplaces to be allies in strengthening Kansas families and protecting Kansas children with their family-friendly workplaces campaign. If you are an employer interested in learning more, you can contact the Kansas Children's Service League at the link that I provided in the chat. And there is also a link in the chat for employees to access a survey to participate in. So please consider doing this and help support Kansas workplaces to create conditions that can support strengthening families, increase recruitment, retention, and productivity in all of those workplaces. Family Service and Guidance Center offers programs and presentations designed to make raising children and teens less stressful. And so on November 28th from 6:30 to 7:30, a presentation called Discipline Strategies That Actually Work with Kids will be available. And if you are interested in attending this, we will have a registration link available soon. And please watch the All In for Kansas Kids weekly emails for this information to come. And so to sign up to receive these weekly emails, if you haven't already, you can go to a link at the Kansas Children's website that I put in the chat. The Early Childhood Recommendations Panel meets on the third Friday of each month from 9 to 11:30, and the next meeting is scheduled for Friday, November 19th. And we just want to keep reminding you that the panel welcomes individuals and organizations to share your thoughts and concerns in either written or verbal form. And during the Kansas Open Forum comments of each meeting, you are able to do this. And so you can submit those to me by the day before the meetings at 5:00 p.m. And I have put my email in the chat, as well as the link to the Kansas Children's website, where you can find a document to help you learn how to submit your comments. We definitely want to hear your voices to help make decisions that can move the work of early childhood forward in Kansas. The deadline to submit applications for round 2 of the Child Care Sustainability Grants is this Friday, November 5th. So you can visit the Child Care Aware website for more details, which is in the chat, and all KDHE licensed child care facilities that are in compliance with child care licensing regulations are eligible to apply. The early childhood block grants and preschool pilot grants are now available. The application process started on November 1st. So the Kansas State Department of Education and the Kansas Children's Cabinet and Trust Fund want to announce the release of these funding opportunities to you. And the purpose of this grant opportunity is to provide early childhood services for Kansas children and families ages birth to kindergarten entry, as well as services for prenatal and family supports. So the applications are going to be submitted through the Kansas Common App platform. And I have shared a link in the chat to the Kansas Children's Cabinet website, where you can find all of the information needed to apply, as well as resources for technical assistance. Applicants will submit a single grant proposal as outlined in the request for proposals. The Department of Education and the Children's Cabinet will collaboratively review grant proposals and determine the most suitable funding source when making grant awards. This cross-agency Common App process is intended to streamline the grant writing and reporting process for local grantees. And both of these grants are intended to provide supplemental funding to fill gaps. And so programs applying must demonstrate that they are investing other available financial resources and community support into their programs before requesting this funding. We also want to keep reminding you of the mental health mobile crisis helpline that is now available. And this offers an additional support for eligible Kansans in need during a crisis. And the services from this are available for all Kansans 20 years old or younger, including anyone in foster care or formerly in foster care, but not limited to children and youth in foster care. And so available resources include over-the-phone support, in-person support via mobile crisis response, and in emergency situations, EMS or law enforcement or the mobile crisis response unit will be contacted to assist. And this is a public service number for use by all Kansans and is not limited to professionals of any kind. And this number is also available for you in the chat. I now want to welcome Dr. Becky Aiken from the University of Kansas School of Social Welfare, Abby Fry from the Care Portal, and Chanel Dupree from the Department for Children and Families to share information on upcoming events for the Kansas Racial Equity Collaborative. Welcome to all of you.
Thank you so much, and a special thank you to Debbie and Hannah, who were so kind to return my email late into the hours one night when I emailed wanting to share the information that we're doing today. We appreciate the work that the Kansas Children's Cabinet and Trust Fund are doing in hosting these important webinars. And so I'm going to go ahead and share my screen. And so my name is Chanel Dupree, and I am with Kansas DCF. Can everyone see my screen? Great, thank you. And so we just wanted to share in about 5 minutes, ladies, what this racial collaborative actually is. So it started very simply over a conversation of coffee, talking about the different issues that we face in our different organizations. And what it has turned into is a commitment from 3 organizations, Kansas DCF, Care Portal, and the KU School of Social Welfare, to really address the issue of Black and Brown children being disproportionately represented and having worse experiences in the child welfare system. But we knew we couldn't address this without beginning to develop a shared language and going on a journey as the state of Kansas. And so we have excellent supporters. We have, of course, the 3 agencies that I mentioned, but also we have Kansas Health Foundation and KC Family Programs, who acts as a support as well. And so I am actually going to kick this off to Abby.
Thank you, Chanel. Like you mentioned, my name is Abby Fry, and I am a regional manager with Care Portal. So we realized that these seem like maybe some lofty goals. So we decided, how are we going to accomplish this mission? So we're doing that by hosting 4 virtual learning lectures. 2 have already happened, and then 2 will happen in this upcoming year. We're bringing in a variety of national experts on some different subjects regarding racial equity. And we're hearing from those speakers, and then we're having a debrief after that. We will also host a symposium in April on the KU Lawrence campus. There's lots of ways that you can find out about these things and connect. We have a dedicated website, and all of these are going to be listed for you in the chat. You can sign up for our listserv, and then there's also links to register for our 2 upcoming online learning lectures.
Hi, everyone. I'm Becky Aiken with University of Kansas School of Social Welfare, where I'm an associate professor and the PhD program director. And I'm just going to share a little bit about how we've ensured that we're grounded in data as we are sharing information during our lectures. One of the key points we've wanted to make is that racial disproportionality and disparities occur across the entire continuum of services at key decision points in child welfare. And so at the first lecture, we shared how during investigations, Black families experience these investigations at a much higher rate than do white families. And this is a national level study. Then we looked inside of Kansas, and we see that Black children are placed in foster care at nearly twice the rate of white children. In addition to looking at those data, we also provided data at that lecture on that showed that Black children experience more placement instability when they're in foster care than do white children, and that Black children exit foster care to reunification at a lower rate than white children. Moving on to lecture 2, we turned to looking at data that were specific to the young children ages 0 to 5, and here you can see that 43% of all children entering Kansas foster care are children 0 to 5. So they make up the largest group of children entering our foster care system. Then looking at the decision point of permanency, Black children exit foster care to a permanent family at a lower rate than white children.
Thank you, Becky. And so this last slide on data just is it's showing the number of reports that the department receives which is over 37,000. And this is why it's so important, because we have data that shows who's calling, right? And so what we see is that we have a diverse group of mandated reporters who are calling, which is why it's really important that this is a multifaceted conversation across many spectrums of professions. And educators make up 25% of all intakes.
I am just going to give us all a quick overview of the two sessions that we've already had on September 29th and October 27th. So on September 29th, we heard from Samantha Mellerson and Michael Finley with the Hayward Burns Institute. This was a brand new organization for me, and they did an amazing job of helping us learn about the history that many of us may have missed in our growing up years, and really provided a great base for us as we go on this learning journey. We had 800 people registered and 600 people attend that. So we were super pleased with 75% conversion rate there. These were some of the goals that the Hayward Burns Institute had for this session. And we think that these were absolutely met. We had really engaging discussion in our debrief, and we've heard some really great comments about how people are learning and going on this journey with us afterward. On October 27th, we heard from Dr. Iruka, and she talked about racial inequities in child welfare, specifically from her view of early childhood education. Again, 799 people registered and 499 attendees. And these are some of the goals that she had for this session. One of the things that I think was especially meaningful to a lot of people was her point there towards the bottom: we must engage in richer actions through our self-inquiry and collective networks to combat racism. I'm just going to share real quick. Richer, she said, stood for re-educate about history, integrate rather than just desegregate, critique everything, humility of privilege, erase racism, and re-envision new ways, approaches, theories, and teams as we're going on this journey together. So these learning lectures have not been for the faint of heart. We're all at different places, but they've been really enriching as we learn together.
Thank you, Abby. And just to close, there are the 2 additional learning lecture dates on your screen, Wednesday, January 26th and February 23rd. And then we have an invitation only in-person symposium that will be held at KU's campus on Friday, April 15th. And so we would invite folks to share, attend, and learn more about this information. And if your organization is doing things and viewing policies, procedures, and practices through a racial equity lens, we want to know about that so that we can highlight that on the listserv that we are doing. Thank you all so much for this time, and we'll put more information in the chat. And I'm going to turn it back over into the hands of Debbie and Hannah.
Thank you so much. I'm so thrilled that we were able to get this information out to everybody today. We'll continue sharing this out as time goes on in both the webinars and the weekly emails that I referenced earlier. And so thanks for being here today, and it was great to hear about this. And now I am going to turn the program over to Michelle Allen from DCF, and she is going to be going in depth with some explanations of pandemic relief funding that's happening in Kansas.
Thank you, Debbie. And Hannah, if it's okay, I'll go ahead and share my screen just to make sure. There are some small changes made this morning, so just want to make sure we have the most up-to-date version. All right, well, thank you all for having me here yet again to talk about all things pandemic relief related to today. We're just going to dive in just to talk about one of the pots of money that had been awarded at the federal level. And then in 2 weeks, we'll come back and we'll kind of dive into the other half of this, which is kind of a beast monster of its own. So I just want to kind of start with some level setting. So I understand that not everyone, when I talk about CCDF, may know what in the world I'm talking about. So the Child Care Development Fund is a federal program that funds all things related to childcare assistance, health and safety, and quality improvement activities across the state. And the primary goal of CCDF is just to improve the quality of childcare for all children. So we in the state of Kansas have a CCDF administrator who is my direct supervisor, Carla. She may or may not be on this call. And it is her responsibility and our responsibility as a team to work with all of these different people and organizations and programs. So we report to the federal government in our CCDF state plan on how we're doing that exactly. And they have very specific rules for us to ensure that we're doing each of those things. And then we're monitored on it every couple of years. And if there's areas where we need improvement, we do that. If there's areas where we're doing great, then that's great too. So within this funding stream, there are some restrictions. We do have a lot of flexibility to make decisions around how we implement different programming opportunities across the state, but there's some rules that we have to follow, of course. So some of the things that we're unable to do is pay for school tuition or any duplicative services provided during the school day for school-age children. We're unable to use any funding for sectarian services unless parents are choosing to send their children to childcare provided in a church facility. That's allowable. And then one major thing that we hear a lot is, well, you have all this money. Why can't you just build some new facilities? We're not allowed to. So that is one thing that we are just very clearly not allowed to do. We are unable to purchase or improve land, do major constructions or permanent improvements to any buildings or facilities, except for minor remodeling or renovations to ensure that facilities do meet state and local childcare standards, which is, of course, licensing and fire marshal standards. And if anyone has any specific questions, we'd be happy to put the source information for any of these in the chat for future reference. And they're also linked directly in the slides. So then in December, the Coronavirus Response and Relief Supplemental Appropriations, or CRRSA, as we call it, Act was signed into law. That law appropriated about $10 billion in supplemental CCDF dollars, discretionary, meaning that we were able to make the decisions around how it was used for states, territories, and tribes. And that was the amounts that each state received was determined by the CCDF statutory formula, and Kansas was awarded about $89 million within that. So this does expand flexibility for us to provide childcare assistance to families and children, support our childcare providers, and also provides the lead agency with funds to prevent, prepare for, and respond to COVID-19. So there's specific goals within the guidance that we have outlined for us, but the primary goal of that is kind of that last sentence, just to help us prevent, prepare for, and respond to COVID. So lead agencies were also really encouraged to use these funds to cover a portion of the childcare cost, typically associated with like co-payments or the family share deduction. So as many of you know, in July, we were able to take away the family share deduction for essential workers and reduce the family share deduction for families who were not essential workers. So allowable uses of this are the same as regular CCDF. We're not allowed to do anything here that we aren't allowed to do with our regular CCDF dollars. So we found out about this law in December, and then in January, we were able to bring on a consulting group, and we underwent pretty intense data collection, subject matter expert interviews, and then feedback from the field. Many of you remember a Smartsheet link that went out where everyone was able to contribute ideas on how we could support the field. All of that information was pulled together and taken a look at and analyzed. And then in April, we received our final portfolio of opportunities. In May, I was brought into my position as Pandemic Relief Project Manager, and we began establishing our project management structure, and then started immediately to design all of the different things within that portfolio. So beginning in July, we were able to do a phased rollout of the initiatives. So some of the internal programs that we didn't have to have contracts or agreements for, we were able to get out of the door really quickly beginning in July. Other ones that kind of required some more intense design or collaboration with partners, or proposals, agreements, contracts, those types of things, those are kind of rolling out as we move forward. So the procurement processes began in several of the different opportunities in July, but immediately in July, we were able to get HERO relief, expanded childcare assistance, and the first round of sustainability grants out to the field. So within our portfolio, we have 5 major spending categories, and some of you may have heard me talk about these here in this webinar before, but we've kind of separated each of the initiatives out into these 5 target areas. So our direct family supports being increased access to licensed, subsidized, and quality childcare with a focus on supporting families in need. Our direct provider supports assisting childcare providers in achieving or recovering financial and operational viability, quality, promoting and recognizing quality childcare. Our workforce, we talk about that all the time, recruiting, professional development, and retaining a stable workforce. And then also infrastructure to make sure that we can do all of these things that we want to do. So our current portfolio, this overview just provides information on CRSA. So I just want to call it out that this is just a portion of our overall relief package when we look at all of the things that have happened over the past year. So each of the areas are broken out across the board, with most of the support within this initial portfolio going directly to our providers. So there's some fun lingo that you get to learn when you're in contract world all the time. So as of Monday, we have obligated about 60% of our funds, meaning there's 60% in contracts, agreements, plans that are signed and in place. About 40% of that is going to projects that are currently in the approval process, or maybe some of the things are out for bid. So overall, when we look at our CRSA spending, we have plans for about 34% of that. And then there's about 6% that we have some flexibility to make some additional decisions around. And then just as far as a breakdown in where we're spending money, as you can see, again, most of that money is being spent under direct provider supports, which is primarily our sustainability grants for round 1. We also have spent some money in the areas of quality improvements and infrastructure. And I just want to call out again, this is only the areas that have been fully executed and paid out. So there's some agreements that have been approved recently that haven't been paid out quite yet, or some agreements that are still either in the development or approval process that will be paid out at a later date. So this will continue being updated as we move forward. And then one additional thing that I just wanted to share before I pass it over to Megan is just kind of an overview of what providers spent money on in the first round of sustainability grants. So over $17 million, which is more than half of the spend, or nearly half of it, if I can do my math correctly, was spent on salaries. And then the next largest category was rent, mortgage, utilities, telephone, and internet. So That was really interesting to our team. We were able to take a look at that and kind of think about maybe why some of that was happening and have conversations with our partners at Child Care Aware of Kansas to better understand the needs, and something that is helping to guide our decision making as we move forward. So I'm going to pass it off to Megan to kind of dive a little bit deeper into each of the categories and the different opportunities that have been planned for each. And then hopefully we have some time at the end for questions.
Yeah, hi, I'm Megan Smith, and I am in a new role. I know I've seen some of you in a different role, but in a new role as the CCDF Program Support Specialist. And so I am helping out Michelle with the relief funding and some of the planning within ARPA as well, or the American Rescue Plan Act. And so as Michelle said with some of those earlier graphs, we still have a lot of things coming down the pipe. And so we kind of wanted to give a little bit more in-depth look at some of the different pieces that we have planned out for CRSA and give you a little bit of an update on where we are within some of those pieces. So the first one is our direct family support. And within that one, we just recently completed our Hero Relief Program, and we were able to increase our subsidy rates to 250% above the federal poverty level, providing more people with access to childcare assistance while removing, as Michelle said earlier, that family share reduction for essential workers. Also within this, the RFP bid just closed on Monday, so we're excited to get this one underway, but it's our family needs and preference study. And really the intention behind this one is to better understand why there's some low demand for subsidy. We know it's a national issue, but Kansas is not unique to this problem. And so also learning a little bit more in depth about the needs and preference of Kansas families and childcare providers and so we'll be contracting with this one hopefully really quickly to help inform future and further decision making. So next would be our direct provider support. And under this one, many of you know, is the sustainability grants. So we just completed the final payments for the first round of sustainability grants at the end of October. And many of you are probably already aware that round 2 closes on Friday. So if you haven't yet, feel free, you can still apply through Child Care Aware of Kansas. And that one is a contract that was an amendment to the R&R contract. Also under that, we are looking at adding some content to the current ITSN contract to support the early childhood field as it pertains to the Kansas Association for Infant Mental Health endorsement. And so you'll be seeing some more information about that coming up. It's sort of in its final design process, and but this is a category we are looking for other opportunities to fund in some of our future planning. So if you have some ideas around this topic specifically, feel free to reach out. And then the last one, and this one right now, is Shared Resources, which is an online tool that provides access to over 1,800 different forms and templates and articles and resources directly to child care providers, as well as potentially access to some telehealth services, as well as discounted supply purchasing. So we're really excited about that opportunity as well. Quality improvement. I believe it was last week, Michelle. Well, it's come out in a few different avenues of updates, but right now, Links to Quality has decided to provide some support in the form of program administration support to help providers by strengthening their business skills. And this with this initiative, providers have access to one-on-one assistance through community consultants, self-assessments, and additional grant funding opportunities to support those goals related to their business skills and practice. And this one is currently available through Child Care Aware of Kansas. But in the meantime, though, links to quality as the state QRIS is still busy being developed and coordinated with other systems components. And we are hoping to begin our phased statewide rollout in September of next year. So next up is our workforce support. And one of those, as many of you know, may already know, Ccdf provides some amazing supports around workforce development and scholarships. And so for this, we were able to work with them to kind of bulk that up a little bit more so they can provide additional professional development opportunities as well as additional scholarship opportunities, and refining those scholarship opportunities to hopefully make them a little bit more accessible. And this is another one that we're also looking for additional opportunities to fund in the future. So again, if you have some ideas around this one specifically, feel free to reach out. Also under workforce support is the Workforce Registry, and this is being developed in collaboration with the Kansas Children's Cabinet Trust Fund. And we are hoping to get an RFP out soon for this. But work has been underway and been busy moving on with this one. So next up is infrastructure. And this is sort of that community level, that more global type category. And so this one, we have included community partnerships and really kind of building that up a little bit more. And that one is in its final draft stages. We're hoping to launch that in July of next year, but it's really looking to support communities around the topic of childcare generally, as well as capacity building, addressing workforce issues, and equity within the field. And also within this is communications and outreach around the relief funding efforts collectively. So we are excited. We were able to bring on Mammoth Creative Co. to support us on sharing information around the relief funding efforts. They helped design this beautiful website, or this beautiful PowerPoint template. But what we're most excited about with working with them is that they're really hoping to tap in to the different pieces that make up the early childhood field within Kansas. That means everybody who really is touched by it or impacts it or is impacted by it. And so we're hoping to tap to many of you in support to support this work through various channels, because we know you all have very unique backgrounds, experiences, and connections to the field of early childhood, as well as children and families in Kansas. So I'm going to pass it back over to Michelle to finish us up.
So I do want to provide some opportunity for any questions or thoughts or anything like that. I see a couple of messages in the chat. I'm not sure if they're questions, but also just want to open Megan and myself up for any further thoughts or ideas or questions about any of the processes that we've explained, any of the CCDF requirements or any of that. Feel free to send us an email. I know Megan and I both have our emails open all day long and are happy to have conversations around any of these things. And then, like I said, we will be back in a couple weeks to share more around the American Rescue Plan and how we are planning and making some decisions around that. Some of the decisions that weren't mentioned, or some of the programming, excuse me, that wasn't mentioned here today is already kind of under that umbrella. So want to just dive a little bit deeper into that. So yeah, I think that's all I have. I can stop sharing and just allow us some time for questions. Okay, I think that silence was long enough. But again, happy to discuss further if anyone has any questions, thoughts, concerns. And just appreciate everyone taking the time to listen in today. And we look forward to sharing more with everyone in a couple weeks.
Thank you, Michelle and Megan. You were very thorough. That's why there didn't need to be any questions afterwards. And we look forward to further presentation from you in a couple of weeks. All we have left for today is just our reminders of what's coming up. As I had mentioned earlier, we have a recommendations panel meeting scheduled for November 19th in the morning. Our next bi-weekly webinar is scheduled for Wednesday, November 17th. And then we have a cabinet and stakeholders group meeting on December 3rd. It's hard to believe we're already going to be in December. So you can find those meeting dates on the Kansas Children's Cabinet website. So in my closing words for today, November is the month each year when we usually stop to focus on what we are thankful for. And so today we here at the Kansas Children's Cabinet and All In for Kansas Kids are thankful to each of you for the services that you provide and the work that you do to support and enhance the lives of children and families in Kansas throughout the entire year. Your dedication, your time, and compassion for helping families is very much appreciated and recognized. And so we thank you for all of that work. We thank you for joining us. We hope that you were able to get some information that's valuable in the work that you do that you can take away from this today. And have a great rest of your day, and we'll see you on November 17th. Thank you, everybody.